As we all know, rural and urban Wisconsin employers have begun to experience the retirement of baby boomers in record numbers. What is particularly true in the healthcare sector is that an aging population not only reduces the supply of workforce, but also increases demand, as the need for healthcare really takes off as we get into our senior years. While it is important to note the long-standing challenge for rural Wisconsin communities to recruit healthcare practitioners, the current supply of health professionals is at best okay for our urban communities. In any event, the available forecasts show that both urban and rural will soon face major shortages. Here are a few examples of the impact of current shortages. Current healthcare professional shortages in our rural communities can mean patients wait longer for treatment, get less treatment that is optimal, or receive no treatment. Or it means they leave their community to get needed care, take revenue out of the local community, weakening the local hospital and clinic. It often takes over a half year at best for a rural hospital to recruit a physician. One co-op member in a very attractive location has been recruiting a practitioner for their behavioral health program for over a year with no results. Unfilled positions lead to more pressure on existing staff, more burnout, and more early retirements or loss of staff to urban communities currently without these challenges. When a rural clinic loses a physician, they don't just lose the direct patient care and financial support to the community, they almost always lose a teacher. It is not uncommon for one physician to annually train several medical students, resident physicians, and physician assistants. Without this training, these learners are not exposed to the benefits of a rural practice and are less likely to consider working in a rural community. Rural emergency rooms are often mentioned as the #1 service by hospitals due to rural farming accidents, vehicle accidents, overdose, stroke, and cardiac events. This requires 24/7 staffing, which is very difficult and often requires the use of very much more expensive interim staff from agencies. If 24/7 coverage is lost, lives will be lost and the community less attractive to live in and to start businesses in. Preventable deaths are higher in rural Wisconsin. The current shortage of certified medical assistants can lead to practitioners not having time to discuss important health improvement opportunities such as diet, exercise, vaccines, mammography. But what about the longer term? One that we must address now so to limit the damage of major shortages in the not-too-distant future. To ramp up production for advanced care practitioners like nurses with a bachelor's degree or physicians, it is not unreasonable to estimate 10 to 15 years from starting an expansion of education and training sites to having experienced practitioners in the field ready for a full practice. In that light, we are already in a crisis, as the Wisconsin Center for Nursing is forecasting a statewide deficit of nurses equal to 15% in 10 years, and with the Wisconsin Council on Medical Education and Workforce forecasting a statewide deficit of primary care physicians equal to 14% in 15 years. Statewide figures of this magnitude will hit most communities very hard, but especially our rural communities who, as noted earlier, traditionally experience staff shortages even when times are good. The Federal Centers for Disease Control released a report in early November that rural communities continue with higher rates for all 5 of the leading causes of death: heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke. One of the root causes of these disparities is rural Wisconsin's slow recovery from the last Great Recession, leading to fewer jobs and less income, major contributors to poor health. A second is the chronic shortage of rural healthcare workforce. The bottom line, the workforce shortages our state is already experiencing and will increasingly experience will make access to affordable health care unacceptably more difficult, no matter how it is paid for.